Hi, I'm Dr. Kannard. I'm the Clinical Director of Moriah Behavioral Health. As the Clinical Director, day to day, I have a hand kind of in every facility. So I support each of the sites with ensuring that their clinical care is up to standard and ethical and is aligned with our evidence-based practices. I do also support with communicating with the families when the clinical team needs a little bit of extra guidance and support. And sometimes it's helpful to have extra hands involved in wrapping around the families to make sure that they're getting the right care that they need. The modalities that we primarily use are going to be DBT, CBT, mindfulness, acceptance and commitment therapy. We have a trauma-informed lens that we're always looking at since a lot of our kids come with trauma, and motivational interviewing. And then some of the unique features about our program, we offer a lot of experientials. So we have an acting group, we incorporate music therapy, we have boxing that we do off-site, we have pet therapy where we bring them on site with a rotation of different therapeutic animals. We're able to work with clients that have a substance use background as a secondary concern, as well as eating disorders as a secondary concern. We're in the process of developing a recovery group for clients that have substance use concerns. So rather than sending them into a community to a group that may not be actively running and that may not be the right fit for the clients, we're developing something that'll really target their needs while they're here, in addition to the mental health treatment. And then we also offer a lot of parent support services during the week as well. We have really robust staffing at the facilities. We have 24-hour nursing. We have 24-hour staff in general. So we have our nursing on site 24 hours a day. We have behavioral health technicians that are on different shifts throughout the day. We have therapists on site, as well as the program directors who kind of oversee the entire facility. Our residential services managers help to oversee facility needs, as well as they oversee the behavioral health techs. We have a dietitian that comes in and works with our kiddos who have dietary needs. And then our psychiatrist will see our clients throughout the week, but most of the time they're involved in our weekly treatment teams, and they do rounds weekly with the clients, but they're available as needed as any psychiatric concerns arise too. For parents who are hesitant about sending their child to treatment, I would say trust your gut, because a lot of times I feel like families will notice things within the home environment, like red flags and warning signs that they may not know if it's true concerns. And so a lot of parents will they'll recognize those concerns, but they won't necessarily get them into treatment. And then over time, those concerns can get worse, and then their child may be at a point where they need to go to residential versus a lower level of care. So I'd say really trust your gut when you notice that something might be off. And then I would also say that it's okay to need help and to recognize that you've exhausted all the skills that you've tried and all the strategies that you've tried to support your child. And that's one of the great things about our team, is that we have so many people in our team that we can really wrap around from a multidisciplinary standpoint. So that way we can figure out what the child needs to be successful, but we can also teach those skills to the parent. So that way as their child leaves, the parent's equipped with the skills that we're teaching the child, and the parent can support them and they can continue to be successful. Day one, we definitely expect the client jitters, and I feel like the first 2 weeks is really that settling in process. So we really just try to take the time to get to know about the client, who they are, what's unique about them, and we try to just take it at the client's pace. So we try to get them involved in the milieu and to start helping them build relationships with staff and with peers. But we don't really put a lot of pressure because everyone comes from different backgrounds, and so some people take a little bit longer to warm up and to settle in, and some people are able to just jump in right away. So we try to be there to kind of walk with them as they're getting acclimated, so that way they know, well, at least I have this familiar staff to go to, even though I may not have connected with peers yet. My motto when dealing with the families is that day one, they're a part of the treatment team. So I'm always like, welcome to the treatment team, now you're an extra part. Because realistically, the parents are the experts in their child, and we're the experts in the mental health part of it. So it's like, bringing the experts together to really provide this very unique service to their child. And so with that, we do a lot of work with the clients while they're here during their stay, but the parents get just as much. And so that looks a little bit different because they're not on site. So we're doing a lot of phone calls during the week to the families. If they're local, we bring them on site to do on-site visits, in-person family sessions. We connect them through our parent support groups, so that way they're learning some of those skills that are going to be complementary to the family sessions. They're building connections with other parents. And they get touch points from almost every discipline throughout the week too. So if they're seeing dietary, they're getting a weekly check-in. They'll get a check-in from psychiatry based on how that appointment went during the week. And then we're always just available as things come up too, which I think is kind of unique about us, is that we're not looking to disconnect ourselves from the parents, but we really want them to not feel left in the dark. So we try to really wrap ourselves around the parents so they know what's going on with their child, rather than just being like on this island by themselves of like, I have no idea what's happening with my child. I think the home environments, they're not sterile. So in the hospitals, there's, they don't have access to a lot of things. There's, not the features that you would see in your home setting, like having furniture and furnishings, being able to hang your art projects on the wall, being able to see someone in the kitchen cooking a meal in preparation for lunch, being able to go outside to swim in the pool. So we offer a lot of those amenities because we want to be like this microcosm of what it's going to be like when they go home. So they're practicing the skills in kind of a similar setting. And that's hard to do when you're in a sterile environment because it's not going to translate as much. So we want them to, have that translating factor of what I'm doing here. I know how it fits into my home setting, but we also want them to feel comfortable as well. And I think there's just a lot of love that goes into the houses too. So like every decoration, every piece of furniture, we set it up so that they can feel safe and know that they're cared about.